Edutainment Studios welcomes you to Parkinson's Disease, Understanding It. This module is part 3 of a 5-part series on Parkinson's disease. Parkinson's disease, or PD, can be challenging to live with due to the fact that it causes progressive changes to the body's motor function skills, as well as many other non-motor areas, which can include bouts of depression, sleeping problems, pain, and cognitive dysfunction. This disease greatly impacts the quality of life in both yourself as well as your caregiver. Although a lot of factors of Parkinson's disease are uncontrollable, actively pursuing all of the treatment options that are available can provide you with a sense of control and help you live your life to the fullest. In this course, the objective is to help you to be able to describe the possible psychiatric and sleep symptoms of Parkinson's disease. Depression can be a fairly common symptom with Parkinson's disease, and it may present itself early on. Not everyone with PD will end up with depression, and not everyone with depression will end up with PD, but it is not a symptom that should be overlooked. Because motor skills are vital for work and recreational activities, it is normal to struggle with a sense of loss, along with the changes in your lifestyle. Strong social support can be helpful, along with counseling by a social worker or a psychologist. If you are older or in the advanced stages of the disease, cognitive issues like problem-solving or decision-making become more common. The changes may be subtle, with no effects on your daily functioning, or you may experience more significant problems with your memory, attention, or planning skills. Many medications used to treat Parkinson's disease can cause or even worsen cognitive impairment. Of these medications, levodopa is the least likely to cause any cognitive issues. There is a possibility that you will experience symptoms like hallucinations and delusions. Hallucinations are sensations that appear to be real but are not. This can involve seeing, hearing, smelling, feeling, or tasting something that is not actually there. Visual hallucinations tend to be more common with Parkinson's disease. Delusions are fixed, false beliefs that a person maintains even when there is evidence to contradict their belief. With PD, these kinds of symptoms are most commonly a side effect of the anti-Parkinsonian medications. Medical illnesses and the medications that treat them can sometimes cause a state of confusion that involves psychosis. You may be reluctant to reveal that you have these symptoms because of the embarrassment or the fear of being thought of as crazy. But remember, it is important to report all of your symptoms to your doctor, since you can often be treated by adjusting your medications or by adding an antipsychotic medicine as the psychosis becomes more disruptive. If you are experiencing severe tremors, you are most likely having difficulty falling asleep, as the tremors intensify when lying down in bed. Anxiety disorders and depression may also cause a delay in falling asleep. These can be treated with anti-anxiety or antidepressant medications. Avoiding beverages containing caffeine, regular afternoon exercise, and watching television or reading in bed are recommended to help with falling asleep. Generally, if you can finally get to sleep, you will also have issues staying asleep due to the involuntary movements that can occur through the night. These movements during sleep may be effectively treated with a bedtime dose of levodopa or a dopamine agonist. Excessive sleepiness during the day can result from poor sleep at night, but can also be a side effect of the medications that are used to treat PD. It is important to be able to distinguish between these two possibilities, so discuss all concerns with your doctor. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 3 of Parkinson's disease, and please join us for Part 4.